An AMA study finds most consumers use cannabis to treat health issues, but very few call it medical, by Ben Adlin. A new study published in the Journal of the American Medical Association looked at survey responses from over 175,000 patients from UCLA and found that 17% reported cannabis use in the past 3 months. The respondents were from geographically diverse areas and were surveyed during their annual medical wellness visits between January 2021 and May 2023. While 76% of patients reported using cannabis for health-related symptoms, very few identified as medical cannabis users. 16% said their use was for strictly medical reasons. 31% said their use was for non-medical and medical reasons. But more than 3/4 of users reported using cannabis to manage a range of health symptoms like pain, stress, and sleep issues. Given these discrepant findings, the authors wrote, it may be more useful to ask the patients what symptoms they're using cannabis for, rather than relying on patient self-identification as a recreation and or medical user. This aligns with another study that found that medical cannabis use is clinically under-recognized, they added. And without specifically screening the medical cannabis use, clinicians may not ask, and patients often do not disclose their use. We provide a crucial point of care opportunity for clinicians to understand their risk for cannabis use disorder, reported the UCLA researchers. The prevalence of cannabis use and the risk for disordered use were highest among male patients and younger adults. Comparable with findings from a recent study, more than 1/3 of patients using cannabis are at moderate to high risk for cannabis use disorder. This group could benefit from primary care clinician-based brief interventions to prevent those from developing more serious cannabis use disorder and to evaluate and refer high-risk users for possible addiction treatment, the report concluded. At the state level, most laws still draw a bright line between medical and non-medical use, with laws commonly requiring a doctor's recommendation and registration as a medical cannabis patient. But in some jurisdictions, that's slowly changing. In Delaware, for example, the governor this year signed into a bill that would allow patients over 65 to self-certify without the need for a doctor's recommendation. The law also expanded the medical cannabis program by removing the list of specific qualifying conditions. Along with this study, JAMA published an editorial about the new findings and that they are meant to assist health professionals in advocating for stronger regulatory oversight of cannabis products. From my perspective, the problem with this study is their conclusion. They gathered great data on the prevalent use of cannabis for health-related symptoms. However, rather than discuss the medical benefits of cannabis use, the UCLA researchers focused on cannabis use disorder. 66% of cannabis users have low to no risk for cannabis use disorder. In comparison, the risk for alcohol use disorder is 2 or 3 times greater. 75% of patients are using cannabis to manage health symptoms. Real outcomes are more important than potential risks. The researchers might have concluded that clinicians should learn about the endocannabinoid system and how cannabis, managed correctly, can be used to improve health while reducing cannabis use disorder. Instead, they are discouraging new users who might have found cannabis safe and effective. Despite the attempt, these UCLA scientists maintain a negative perception of cannabis. It's no wonder patients are underreporting their use, as they are likely to be referred for addiction treatment. This is Dr. Jean Talleyrand with High at 9 News.
Interesting, Dr. T. Very, very interesting, if I do say so myself.
So it's just what I suspected. 3/4 of you guys are using it for health-related symptoms.
But and that just goes to the point of when we say all use is medical use, right, Dr. T? Because a lot of people don't even realize that they're using it for medical uses, and don't necessarily claim that, even though that they actually are.
Well, but something that Dr. T has pointed out a couple times when we've had this discussion on High at 9 is accepted medical use. So like in Schedule 1, right, Dr. T, it says that there's no accepted medical use.
Mm-hmm.
Right. And so the distinction between medical use and accepted medical use is an FDA sanctioned clinical trial, correct?
Well, it's currently now an HHS recommended designation, as they've recommended Schedule 3 without FDA trial. So it's really HHS that's in charge of classifying in some way.
Mm-hmm.
Right, but I guess the distinction, so we always knew that there was medical use for cannabis, and, again, the U.S. government's own patent on the neuroprotective properties of cannabinoids tells us that, yeah, there is a medical use. You drew a distinction when we were talking about scheduling on accepted medical use being something that has to be proven in a clinical trial versus something that is just, we have some laboratory results that show that we can reduce neuroinflammation or show that we can kill cancer cells. Well, killing cancer cells in a petri dish versus actually having clinical data on humans, I think crosses that bridge of, I think what you referred to is, I want to say it's accepted medical use, and that's exactly the language that is in the Schedule 1 thing, is that there is no accepted medical use. So there could be a medical use, but it's not an accepted medical use. Is that right? Am I using terminology?
Well, I mean, that's the point. You're exactly right. And that's the point that HHS argued to the Department of Justice. They said, now that there are thousands of doctors who are accepting the medical use of cannabis, then we are saying that without the FDA, it's an accepted medical use. And then, of course, there are lots of studies showing its therapeutic effects. And so that's where you get the medical, and that's why they recommended rescheduling. So they changed their tune. I mean, they were using the old tune before, and this year they changed it by saying, okay, there's a lot of docs out there giving recommendations, accepting the use of cannabis as medicine. So now it is accepted medical use.
Fascinating.
DOJ didn't like it, but they had to take it.
They definitely did not like that. That's for sure. Oh, man. You any thoughts on this, Rico?
Yeah, I mean, I'd echo your sentiments that, like, all use is medical use. Period. Like, whether you want to call it medicine or not, cannabis is medicine. It's just medicine that you can enjoy. And it has a fraction of the side effects, the negative side effects that these bullshit chemicals that, so-called medical industrial industry wants to pump.
Well, my point is like, my point is like, even if you don't think that you're using cannabis for a medical use, and let's just say you just want to smoke cannabis for the sake of smoking cannabis, you actually technically are using it medically, even though you don't realize it, because your body is going to be experiencing all of the amazing health benefits from cannabis, whether you want to accept those or not.
Right. I think it'll be interesting to see, decades down the line, a lot of the ailments that we've been dealing with, like, were they just because we had a endocannabinoid deficiency, right?
It's very true. Very true. It's probably going to
be. And it's kind of like, we're talking about how finely divided the English language is when we say medical use versus accepted medical use. It's like, okay, right? I mean, so it's like, how finely divided is the English language? So if it's accepted by the individual who's using it, it's accepted use, right? But it's not accepted by the pharmaceutical company, healthcare dictatorship that we live in, which wants to prescribe you billion-dollar pharmaceuticals paid for by billion-dollar drug insurance, bought at billion-dollar drugstore, right? I mean, isn't this truly just a money play?
Well, that's why we didn't go into law school, Mark.
Fair enough. And on that, we're gonna roll right into a commercial, and we're gonna be right back.